Number 1,
2, 3, 4, 5, 6,
7, 8.
Good morning, guys, and welcome. My name is Velma, and I'm here today to talk to you about ethics in healthcare, specifically the choices that we have to make for end of life. As nursing students, as well as nurses, this is something that you guys will be presented with or confronted with on a daily basis. Visitors, family members, colleagues, everybody is going to think that you are the expert on end of life because you work in healthcare. So what do you do? How do you answer them? I'd like to go over that with you today. I'm going to share one of my personal experience. We'll go over things to consider, and then I'll open the floor to any questions that you guys may have. Things to consider with end of life choices. The first thing is quality of life. What is the individual's quality of life? Does the person want to live as a persistent vegetative state? Will they have to have 24-hour care? Who's going to provide that care? How will it affect that individually, financially? The individual right to choose. What do you do when your patient says, just let me die? Even if you know that there's things that can be done to save his life. He's made a choice. She's made a choice. How do you respond to that? Artificial nutrition and hydration is another choice that needs to be made. The patient can refuse to eat. Do you then inflict your power or your authority to say, we need to start tube feedings, we need to start intravenous IVs, we need to do something to hydrate and provide nutrition for this patient? Cultural and spiritual beliefs. Everybody looks at death and dying in different ways. Each culture is different. Some people view death as a punishment from God. Why is this happening to me? What did I do to deserve this? Other people look at it as moving on to another life. There's a life after death. I've done my work here, now it's time for me to move on. Becoming culturally sensitive is what I suggest for that instance. Listen and never give the choice. Never make the choice for the individual. Deciding to withhold or withdraw life support is another end-of-life choice. Once the victim or the patient is on the ventilator, who decides to remove it? Family member may not know, what the choices are, how to approach that. So you, as the healthcare provider, as the individual that is supposed to know what goes on, can help them make that choice. Advanced directives is the #1 thing for end-of-life choices. Always plan ahead. When you can advocate planning ahead, making the individual think about what they want as end-of-life choice, what it is that I want to go ahead and start. Do I want to have artificial nutrition? Do I want to have artificial hydration? Do I want to treat? Do I want to be on a vent? Nobody can answer that better than you can. Here's my personal story. That's me and my grandmother. My personal story involves the death or the end of life with my grandmother. Before I was a nurse, she came suddenly ill, short of breath. Nobody really knew why. We went to the emergency room. They discovered that she had a mass on her larynx and her tracheal area. There was the choice to remove the mass. It would damage her larynx. She would have to then have what we call a tracheostomy inserted. That's a hole in the neck. It'll help breathe. It'll help her breathe until she's able to breathe on her own. So then my question was, how long would it take before she's able to do that on her own? There was no definite answer. My grandmother was not able to speak because of the airway problems. To speak was difficult for her, so the family was left with making the choice. Do I send her to surgery at 70, knowing that anesthesia itself can harm her? Will she come back from that? And if so, how long will it take? Who's going to provide the care that she needs? Will she need a ventilator when she goes home? Does she need 24-hour nursing care? What are we going to do as far as eating? That means we don't have to put a feeding tube. Hydration, how are we going to, do that because she can't eat or drink that way? It would have been so much easier had we as a family talked to her about what she would want at this point in her life. Sometimes the decision is forced upon you, but when you can, my advice is to avoid it. Bring up the subject. Talk to the family members, talk to the patients, talk to your loved ones, even in your personal lives, about end-of-life choices. professional role in the end-of-life choices is always to affirm death as a normal process of living. We're all born to die. It has to happen at some point. And whether we think so or not, doctors, nurses, family members, medicines, whomever, nobody has the last word. There's a higher power. We can give advice. We can say what we think can happen, but nobody really knows. I've seen it happen time and time again. People have been predicted to have 3 months and they live for 3 years. So when they can make the choice themselves, as a professional, you empower them with the knowledge that they need, family member or patient, give them the tools to make the decision for themselves. Never make the choice for them. That can end up very, very bad. They can resent you for telling me to do that, and maybe she would have lived. So keep yourself out of that predicament. Empower the individual to make the choice themselves. End of life choice. Making decisions for your own care. The living will is the take-home point here. I've stressed again and again, make your own choices. Bring up the difficult subject. Ask your family members, ask the patient to decide before it gets to that end where you can't make the choice because you're incapacitated. Does anybody have any questions or concerns about what we've talked about here? Yes,
Who
ma'am.
initiates the subject of the living will?
Normally it's the doctor's or the physician's job. But how often do they push it off to the nurse? So most of the time it's the nurse that has to bring this up to the family members. We have to initiate it. It's difficult. The procedures that you would take for that is to call in the chaplain. And here we have the chaplain go in and discuss it. But we have to let them know what we're doing. Let them know that this is a choice you have. You can make that with your family. We'll have the chaplain come in and discuss to you what your options are.
Can we witness the signing?
No. Legally, that is not a good thing. They could say that you have some type of ultimatum for helping this patient die. Sometimes you can be accused of incentives, receiving incentives or helping that. So you always want to have somebody outside of the care of the patient, which would be the chaplain and maybe a couple of volunteers. They usually come up and help with those signing and witnesses. Any other questions?
Could you elaborate a little bit more? What is a living will?
A living will tells a person what type of treatment plan you would like to have in the event that you're faced with death or dying. It lets them know whether or not you want to have that artificial hydration or feeding. It lets them know whether or not you want to be intubated, whether you want a ventilator to do the breathing for you. Do you want to treat? Do you want to pay? It helps to answer all those questions. There's no guessing. You get to say what it is you want. And hopefully your loved ones will follow your wishes. I'd like to thank you for your time. I hope that I've enlightened you on the subject of end of life and the choices that you all have. I think you all make great nurses. Don't be afraid to bring it up. Even as a student, you can empower people to make the choice that they need to make at the end of life. Thank you.